Okay, so today I want to do a video on our telehealth appointment. This is the appointments that you can do from your phone, from your laptop, your desktop, your iPad, and the best part is the convenience of your home. You don't have to wait in a waiting room. You just log into the app or go to your patient portal and you will be connected with your provider. I'm going to do an actual appointment today with our nurse practitioner, Colette Blanchard. She's going to answer some questions and kind of give some insight on a telehealth appointment. So let's go ahead and get started. All right, so I'm going to show y'all how to go directly to the app in your phone. So you're going to go find it, and here it is, the healow app right there. It's going to come up, put your password in, and this is the login for it. So you see there's appointments, medications, check-in, find appointment, trackers, my records. To go to your telehealth appointment, you are going to click on appointments. From here, you see I have an appointment scheduled with Colette Blanchard at 4 p.m. And I'm going to click on that. Once I click on this, you see that bottom orange part that says Start Televisit. You're just going to click on Start Televisit, okay? And it's going to load, and then it's going to ask some fun questions like height. I'm just going to put my height in, and there we go. Weight, of course, 120. And my blood pressure is going to be 110/68. That's a really good one. We're just going to go with that 98 that's already right there as an example. 72. We'll do 72, and then you will submit your vitals. And once you've submitted your vitals, you can do start your televisit. And my phone up right here so I can get ready for Colette. And this does take a minute to connect. I found when I tried doing this before. All right, Colette. So one of the things that everyone is wondering is what kind of appointments can we treat through telehealth appointments?
We can treat all non-emergent visits through this telemedicine type visit. Things such as discharge, urinary tract infections, anxiety, depression, medication refills, problems with your medication, your birth control pills, your hormones. If you need a refill on those medications or you need for us to change those, we can do any of these type visits.
Okay, so what kind of visit would we not be able to do through telehealth? Like what would not be able to be treated?
Anything that would be more urgent or even acute, such as heavy bleeding, bleeding with pregnancy, severe pain or cramping with pregnancy, contractions with pregnancy. Even if someone thinks they have a lump in their breast, they certainly could do a telemedicine visit for us to find out what's going on and possibly get them into the office to do a diagnostic mammogram.
Okay, and so another question that people have is, how can you treat me without putting your hands on me?
So much of what we do is by listening to your symptoms, finding out what's going on with you, and getting a really good description of what's going on. And by listening, we can make a differential diagnosis of what's going on and then treat based on that diagnosis and call in the medications. If we need to, we can get lab work done, but that would be done through the office. But we'll try to treat whatever we can just based on symptoms.
Okay, and a big question is, will my insurance cover this visit?
Yes, insurance is covering telemedicine visits. There's a pricing that has been set up by the insurance companies, and we will be following those guidelines as far as the billing for these visits.
Okay, perfect. And the last question we have is my privacy protected through these appointments?
Yes, definitely. The app that we're using is actually the same app that we use in the office setting. So when I am actually looking at your chart as we speak, I will be updating it whenever I speak to the patients online. And this is all protected through our app. and through our personal computers.
Okay, awesome. So those are pretty much all the questions I have. Is there anything else that you can think of that patients should know about with our telehealth appointments?
We just want our patients to be aware that we are available to you during this time where we're doing social isolation. We want to keep as many patients safe as possible, so we'd like to see you through telemedicine instead of having you come into the office. So for those non-acute things, we can certainly see patients. For our patients who are scheduled for annual visits, they can come after this crisis is over with. But if they need any other problems addressed, we can certainly do that through telemedicine. And if there's a question, all they have to do is call the office. They can speak to one of our nurses that's in the office to determine if they meet the criteria for doing a telemedicine visit versus coming into the office.
Awesome. And basically, this is it right here. The way me and you were talking, this is how the visit would be, super easy, just like this. And then your prescriptions sent to the pharmacy.
We can actually see each other. If you have a rash or a cut, something such as that, you can show that to us through the video. And I'll be looking at your chart, seeing what you're currently being treated for, what medications you're on, allergies, any previous surgeries. So I have your chart in front of me. So we can go through all of that. I'll ask you questions. I'll be listening to you, making a diagnosis based on what you're telling me. And then we can treat accordingly. And then if there's any type of problem afterwards, that may require a follow-up, such as if we treat for a urinary tract infection. We're going to treat with the most common antibiotic. We'll have you take that week of antibiotics. And then if you're still having symptoms a week out, then we would have you come into the office and do a urine culture to determine the bacteria that may not be covered by the antibiotic that we gave.
Awesome. All right, well, thanks, Colette.
Thank you.
All right, so it was as easy as that. Telehealth appointment done right here in my living room, at my house, on my phone. Super simple. To get scheduled, give us a call at 201-0505 or visit our website, awhbr.com. You can use the patient portal or you can use the healow app on your phone. Again, any questions, give us a call, and I would really, really appreciate any feedback we can get back on our comments with this video. We are here to help you.